Just 10 minutes away from Johannesburg's upper-class suburb of Sandton is the informal settlement of Alexandra. Here, people live hand-to-mouth. The township is cramped, and it is not uncommon to find 12 people living in a one-roomed shack, making safe distancing practically impossible. Efodia Makanita lives here with her 3 children. Money is tight, and not only does she worry about putting food on the table, she also worries about catching the virus.
You see where we are staying, people are not sanitizing, they are sharing cigarettes, they are drinking, they are sharing beer. I heard that the vaccine is for the rich, and then we, as we are poor, we can't afford the vaccine because they say the vaccine is too expensive.
The government has put its hopes on the AstraZeneca vaccine, which will be sourced from the Indian Serum Institute, the largest vaccine manufacturer in the world. The process is currently underway to acquire the jabs through the African Union and a vaccine sharing scheme called COVAX, which allows poorer countries to compete on the open market to receive their share. Yet the operation is still expected to cost the struggling South African economy $2 billion. The first 1.5 million doses are expected to arrive by February, with the rollout campaign said to be the most challenging task in the country's history.
Obviously, the frontline healthcare workers are the top of the list. And that includes first responders, it includes also cleaners, porters, all those people that do come into contact and are at risk of picking up COVID. They are key personnel who might not be healthcare workers, who are also at risk, key personnel who need to keep the country going, keep the economy going.
The lack of clear communication from the government as to what the cost of the vaccine will be to the average citizen has left many wondering whether it will be provided for free or whether they will have to pay. Some private medical health schemes have said that they will subsidize the doses, but this creates a concern that inoculations will be given to those who can afford to pay for private health care ahead of the more than 30 million South Africans who live below the poverty line.
Our best hope now, health-wise, vaccine-wise, is essentially getting the private sector to bring in some of the vaccines, to administer them, and to help the government to roll out, because rolling out to 70% of the population is going to be one hell of an undertaking. I think the biggest problem is government is a bit divorced from reality.
With a shrinking economy and record unemployment, South Africa has been reluctant to enforce more severe lockdown restrictions. Government's plan is to vaccinate 67% of the population, around 40 million people, by the end of the year in order to achieve herd immunity. Such an ambitious process will undoubtedly come at some expense to the public, but millions of South Africans are hoping that their limited financial situation will not cost them their health. Sasha Star, CNA, Johannesburg.